Good afternoon, everybody. Thank you for joining us this afternoon, for taking your time out on this Friday afternoon to listen to our exciting work in the Starworks project. I'd also like to thank all the funders and collaborations that have worked with us on this project that have turned it into what it is really. So that's the NIHR and our main partners, Lab for Living and LimbPower. So just briefly about me, I'm Nathaniel Mills. I'm the program manager, the paediatric program manager for NIHR Devices for Dignity and NIHR Children and Young People MedTech Cooperative. So just briefly, D4D is one of 11 national medtech and in vitro diagnostic cooperatives, and we've been funded by the NIHR since 2008 to act as a catalyst within the NHS for the development of new medical devices, healthcare technologies and technology-dependent interventions. We focus on developing technology solutions to meet clinical needs and for chronic health conditions that are often overlooked and are typically associated with loss of dignity and independence and poor patient outcomes. So our remit in this project was essentially to do what it says on the tin really, and really catalyse all stakeholders, bring them to the table and work alongside Lab for Living to stimulate and catalyse unmet needs into valid ideas and take forward and turn these valid ideas into tangible projects. I'd just like to highlight on the right, we've got the involved key principles chart there, and what we hope will happen is as we go through the slides, it will highlight the current section that we're talking about for the involved key principles. So the Lab for Living methodology is complementary to what we try and achieve in D4D, and it seemed like the perfect fit for this project. And I'd like to hand you over to my colleague Joe Langley.
Hello, my name is Joe Langley. I'm a design engineer and a principal research fellow in Sheffield Hallam University with the Lab for Living team. Lab for Living is a small research cluster, interdisciplinary research cluster within Sheffield Hallam. We're based in the Art and Design Research Centre, and our focus is on using creative and design practices as research methods and tools within the academic sector, focusing on health and well-being.
Okay, and my name's Gemma Wheeler. I'm a design researcher based in Lab for Living with Joe here, and we work quite closely with that, as he's highlighted. I've got a background in product design, but through Lab for Living, I've learned a lot more about the methods that we use to involve people meaningfully, whether we're designing products or services or interventions, and what aspect of creative practice that we use. And we also have Carly with us. Carly, do you want to say a few words about yourself?
Hello, my name's Carly Bowert. I work for the charity LimbPower. I'm the Children and Family Officer, which I think I'm probably the only designated Children and Family Officer for children with limb loss in the country, so I'm quite busy. I'm also a mother of a child who wears a prosthetic leg, so I get contact, I live it, but I also get contact with lots of other families. And I think what we've developed is a partnership where LimbPower is able to provide a bridge to the families and to the end user.
Excellent, thank you, Carly.
So back in March 2016, the Department of Health announced a budget for activity limbs for children with prosthetics. The program manager for Devices for Dignity at the time was a lady called Dr. Nicola Heron, and we can't go forward any further in this presentation without name checking Nicola. None of this would have really been possible without her. When this announcement was made, she really quickly got on the case with doing some background work about the whole sector, and came to the conclusion that within the paediatric delivery of prosthetic limbs, there was something that could be defined as a market failure. So this is where the market forces are insufficient to catalyse change and innovation within that particular sector. And this was due to the very small numbers of prosthetic limbs that are required and the rapid turnover. So with the growth of children, the way in which they only use one limb for a very short period of time before they grow out of it and require something different. And within the provision as well at the time, the limbs were very limited in what they enabled the children to do. So children often had to change from one limb to another, if they were fortunate enough to have more than one, in order to do different activities. Something else which Nicola had noticed within this background work was that there was a separation between the different stakeholders, so between industry players in the prosthetic sector, the NHS, children and families, and the academic academics involved in research in this space, there was very little interaction and communication. And she had a view that what we might do is try and create something that brought these together to identify what the challenges were to innovating in this space, and try to change the market forces and the market structures in such a way that innovation could then happen sustainably of its own accord. We realised that we didn't have the answers on how to do this from the start, and so we identified that a co-production approach would be something that we should adopt. Within this, there was obviously a huge number of different agendas and people with vested interests and personal agendas. So politics and power and stakeholder interest was a really important aspect that had to be considered throughout, but especially in those initial setup phases. And we called to mind Trish Greenhouse's points about co-production when she says that we need to take a systems perspective. It needs to be a creative enterprise, and we really need to pay attention to the governance and process and the way in which stakeholders work together. And this is what NIHR really catalysed and led us to do.
Great. So Joe has highlighted the key stakeholder groups that we work with there. So obviously the children and families, the NHS, academia and industry. And in this presentation, we'll be focusing more on the children and families, which is the work that we did. But just to give you a full picture, we'll briefly touch on how the other work streams were involved as well. So the main meat of the work started with an unmet needs assessment from these different stakeholder perspectives. And each work stream took a different stakeholder group and kind of wanting to understand what was important for them. So the NIHR Health Technology Cooperative in Brain Injury, based in Cambridge, ran a clinical audit and a series of surveys with clinicians to understand what was going on, from an NHS perspective. And surveys were felt to be quick tasks that clinicians with heavy workloads could hopefully be able to do. And you'll see that each work stream edited their methods according to the stakeholders they were working with. In terms of industry, our partners in TrustTech, a healthcare innovation consultancy based in Manchester, led the industry work stream, and they conducted desk-based research, promoted things like that through social media, and conducted online surveys and telephone interviews with some of the key players. The trauma management healthcare cooperative based in Birmingham led the academic branch of the unmet needs assessment, and they did a review of all publicly funded research projects related to prosthetics in the UK. And they actually found a total of 44 million in research funding, but only 10% of this was related to limb prosthetics, and none was specifically targeting children or young prosthesis users, which really just kind of cements the need for this work. So moving on to the children and families, this is the work stream that Lab for Living, Devices for Dignity, and all the partners like Carly and so on led. We worked together to engage these families in ways that were meaningful to them, and it was important to include a range of methods with this group to capture the different perspectives of young children, older children and parents as well. We made visits to hospitals and limb centres to meet families and prosthetists, hosted several workshops across the country, and conducted several phone calls with families and developed bespoke surveys for these different age groups. And we coordinated with the different limb centres across the UK to distribute them. And you can see an example of one of the survey questions here, where we asked children if there was a superhero that had your limb, what would they look like and what would they do? I don't know if you can see here, but this guy, he can fly and he can kick people really hard. So it was really nice to see these range of answers. It's probably a good snapshot of the creative and asset-based approach we took to working with children. The questions and the modes of answers needed to be in their language so they could most fully express themselves. And there's also listed richer insights, as you can see here, that detail the crucial everyday issues that might not otherwise have come up. We found that in a range of projects working with children, they just aren't used to discussing their medical challenges in a fun way with adults, so it can yield interesting results. And speaking of results, we also tried to capture the insights we gained in a visual, creative way, such as this day in the life storyboard of a child using a lower limb prosthetic. This helped us to reflect what we learned back to the children in their language so they could confirm or correct us. It was also a useful way to share these insights with other stakeholders in later stages of the project to bring everyone up to speed with the real life reality of living with a prosthetic, which we'll go on to now. So once we finished the initial unmet needs assessment of the 4 stakeholder groups, we pulled all the insights together and consolidated it into 4 key challenge themes. And these were sockets and liners, personalisation and adaptation for both upper and lower limb prosthetics. So that was 2 separate themes. And also service journeys or digital innovation within that. There was also 2 cross-cutting themes of activities and daily living and what we called Let Kids Be Kids. And that was a response to a very common message from a lot of families that they have a really reduced sense of spontaneity, having to think about taking extra socks, extra liners, all these kinds of things. Kids can't just jump in the river with their friends or get muddy and dirty. So we wanted to keep that in mind. So each of these themes were used as a challenge for 4 sandpit events across the country. These sandpits were full-day workshops involving children, families, academics, clinicians and industry experts to creatively and collaboratively address each challenge theme. And we spent quite a while, as in several months, trying to plan a workshop that truly embodied the co-production principles to the best of our ability. And that was hopefully in terms of the structure, the supporting materials and the environment, which I'll go through quickly now. In total, we engaged approximately 15 kids and family, children and family members and 61 professional delegates, although several attended quite a few sessions, which represented 33 institutions. And we also ran them 2 sessions on weekdays and 2 on weekends to try and minimise the impact on workload or school. You can see the overall structure of the workshop on the right-hand side here, and we began by asking participants from each group to describe the challenge theme from their perspective. We then had a break for inspiration, which involved exhibitions, posters, interactive presentations and videos. And often this included projects or themes that weren't exactly related to prosthetics, but could be used to inspire. Next, we ran an ideation session around the challenge theme. And here the participants were encouraged to go for quantity rather than quality, and using a template that you can show on the right column of you can see on the right column of images. Over lunch, participants had 5 voting strips to give to their favourite idea or ideas, and that determined the top 5 ideas that we would develop in the afternoon. The day rounded off with a Dragon's Den style of pitching each team's developed idea, and sometimes with some improv theatre, which you can see in the bottom 2 images, and you might be able to spot our co-presenter Carly in that middle right image there. Participants also had an opportunity to sign up to a pitch project that they wanted to be involved in going forwards, and to what extent they wanted to take part, and you can see that in the involved co-production document. In terms of the environment, we tried to create a fun environment to encourage people to take risks and try new ideas. So things like having tablecloths that you can draw on. Us as facilitators, we wore branded t-shirts to kind of help us facilitate but not take over the sessions. And we also avoided PowerPoint as much as possible, so trying to keep information visual and stuck on the walls for the duration of the workshop. And this all helped with that. We also acknowledged that many of the participants wouldn't be used to taking part in creative activities with strangers in mixed discipline groups and with children. And while this isn't a bad thing, it may just be universally unfamiliar. So tasks such as collaboratively agreeing on ground rules at the start, and also starting the ideation session with quick warm-up activities were important. After each workshop, with permission, the outcomes from each event were scanned and uploaded to a shared online repository, which is accessible by all participants. This aimed to maintain an open network approach, as well as build a sense of transparency, ownership and capacity within the network. It's important to say that we iterated this format slightly over the 4 workshops, and that is a key part of co-production for us, really, is being open to adapting the plan on the day, and also being reflective and honest about whether your tools are actually supporting meaningful involvement. We also asked each group to fill in some feedback forms where professional and academic participants regularly stated that the opportunity to work with stakeholders, including families, was one of the biggest benefits of the Starworks project. It's also important to recognise when you've been talking for quite a long time and you can only speak from your own perspective. So I'm now going to hand over to Carly, who's had many different roles within the project and who would like to share her experiences of the project so far.
Hello, thanks for inviting me to join you for this. I'm probably going to speak more as a parent initially. I think that there's been very little research done into children's prosthetics. In my professional role, I'm also the administrator of activity limbs, so I get a view that many other parents don't, but I try and share it with the other parents. as I became involved with Starworks, I have to admit that you start to think, oh yes, it's someone else asking questions. It's another survey that I'll never hear back from. The thing for me is it's really important that the families that we bring to the table, and we have brought a lot, that they actually do find out what happens to this research. It's really important that they feel comfortable. And one of the things that I've felt with Starworks is, over the last couple of years, families are starting to build confidence in Starworks. Now, when I mention to families Starworks, they go, oh yes, and they know who they're talking about. I think the sandpits were absolutely brilliant. It was great for us as parents to actually meet professionals that we were sitting on the table with, because I think as a parent and anyone that's in a patient and medical personnel, sometimes you can feel like it's them and us, and it's really important to us that the families start to realize that we're all trying to create the same thing. And I think something that became very, very clear is it doesn't matter what's on the end of a prosthetic leg. If the socket doesn't fit properly, then forget it. And the great thing was you would have a mum saying that, you would have an 8-year-old saying that, but you would also have a top consultant saying that. So everybody was in agreement about this whole thing. I loved the way the sandpits were run. I loved the way that the children were interactive. My son particularly enjoyed it and was definitely into the theatre productions. But I think the main thing is he's 12 years old and he's grown up feeling that he has some control over what happens in the future, and that it's not just a case of, well, you go to the limb centre and you get what you're given. I think that's all I can really say about the sandpits. We actually bring families together, and one of the things we were identifying is that Starworks really needed to have a big groups of families together. And it's hard because families don't always trust medical people. They don't always trust research. You're talking about children. We're all protective over our children. Recently, at the end of September, we invited Starworks along to our ICANN camp, which we had 18 families with limb different children and their siblings and their parents. I haven't actually told Starworks this, but I've just got the evaluations back. 94% of the parents said that it was beneficial to be at Starworks and they had learned something that they did not know before, and that they would be keen to return to Starworks events. And I think that speaks for itself, 94%. Is there anything else you'd like me to say, Gemma?
I don't think we could ask for any more than that. Thank you very, very much.
It honestly wasn't scripted.
Just to round things up, I'm going to hand over to Nat to explain what else happened in Starworks 1 and what will be happening in Starworks 2.
Thanks, Gemma. And just to thank Carly for her support and guidance through this project. And I think hopefully we're illustrating how important and how vital it is to have service users, children and families in this case, involved in projects like this. So thank you, Carly. So just very briefly then, thinking of time, as part of this, what we did is we launched a funding call, which was parallel to the sandpit events that Gemma described for you earlier. And this was for proof of concept funding, where cross-sector partnerships could apply for up to 50k each to develop an idea. The response to this call was quite overwhelming, really. We had 23 high-quality applications across all the different sectors, which were reviewed by a multidisciplinary panel with expertise in at least one of the 4 areas: parent and child, prosthetics, technical, and NHS impact. We eventually whittled these down to 10 funded projects, which are summarised in the thumbnails you can see on your screen now. And you can also tap into the D4D website if you'd like more information, or contact us through Gary or Richard after this. And there's a new Starworks website up and running soon. Just to say, the key requirement of the 10 projects was that children and young people are involved in the project, and I think we've seen that throughout the majority of them, and that's really guided them to a stage they're at now. So we personally set up the projects in a few different ways in terms of clarification of proposal, setting up collaboration agreements, giving advice on the ethics and medical regulations. And we also ensured that there were structures in place for the projects to learn from and support each other. And I think that's been a really valuable insight into this, where we regularly got the projects together where they could share ideas and learn off each other and make connections. So just to summarise and finish off, our next steps to develop a sustainable network going forward. A key focus of Starworks 2 is to build this sustainability so that the momentum that we have built for the research into child prosthetics does not run beyond the current funding window. We hope to achieve this by expanding the network with all stakeholders, exploring key challenges that arose out of Starworks 1, such as the need for meaningful child-specific outcome measures. And as we have endeavoured to do throughout this project, our key aim is to ensure the voices of children and families remain at the centre of what we do, which is why we have recently launched the Starworks Ambassador Scheme. And this is what Carly mentioned earlier about the great time we had in September down with the charity Limpower. So we put this together because it can be challenging for children who use prosthetics and their families to take part in research for a variety of reasons, as I hope we've highlighted during this presentation. But they do include taking time out of school or social time, practicalities of travelling, and the fact that some of the challenges can be difficult to talk about. So the Ambassador Scheme very much focuses on children who use prosthetics, as well as their siblings, who provide a wealth of information and guidance and support to hopefully acknowledge and reward their hard work. We give each ambassador a passport where they can collect a sticker for each of their research activities that they take part in. One of our learnings from Starworks 1 is that very much that we have worked with the parents and co-designed with them to try and find new ways to engage with the children and really, like Carly said, I think make them feel part of it, that they are being listened to. So once they've filled their passport with stickers, they can send it back to us and receive a certificate and some vouchers as a thank you. And we've also planning a bronze, silver and gold passport scheme as well. And we have nearly 20 children registered, and there's many more requests to be processed, and hopefully a growing community of empowered to have their say and support Starworks going forward.